All right, welcome to part 2 of the FLOA protocol, the series of 3 webinars taking a deep dive to explain why our program has been wildly successful. So hopefully you've seen part 1 and you're watching this in order, but maybe you wanted to nerd out and geek out on the science first and get a better understanding. This is why I separated so that you can jump forward to whatever part you want, but ideally you watch them in order of 1, 2, 3. So part 2, the science of the problem and the science of the solution. What we're gonna cover here is the difficulty with sustaining weight loss, like what's going on in the background, the science of obesity a little bit more, insulin resistance, metabolic flexibility, inflammation, and thyroid, because all of these play an integral role in your body's ability to lose weight and keep it off for the rest of your life. Okay, so what are some of the issues with the difficulty? What's causing it so hard for us to keep our weight off, right? Because when we look at weight loss, anybody who's struggled with weight for the majority of their life or for a couple years at least will tell you, for most people, it's not that they can't lose a couple pounds to begin with. Some people do have that issue, but for most of us, it's that they lose the weight, but then they regain it back. They can't sustain the weight loss. Like, what is going on? What are the mechanisms preventing the body from keeping the weight off? Is it just that I lost all self-control and I got very lazy, as much as some people want to tell us, or maybe I want to internalize and feel? No, because you remember from part 1, 70% genetics are working against you. So now we're going to understand what is it that the genetics are doing for the entire population and why it's worse for the 70% of people. Okay, but let's first look at what we've been doing. We talked about the increase in carbohydrate consumption and the overall thought of decreasing calories as the solution to obesity, and we know that's not working. So we know that calorie restriction simply doesn't work. How many times have you lost weight in the past by restricting calories only to regain it back? What the heck is going on? Well, there's a lot of physiological changes in the body, but in essence, what your body is doing to combat the weight loss is decreasing your metabolic rate and increasing your hunger. This is your body's attempt to bring the weight back. We call that the weight set point. Your body has a weight set point. In both ends, it is trying to bring your weight back to what it thinks is ideal, and it does that by affecting your hunger and affecting your metabolism. So I like to think of a thermostat in the house. So you got the thermostat set to 70 degrees. Now you want to cool off, so you bring a portable AC unit. That's the equivalent of exercise and a diet. You turn it on, it lowers the temperature, and it probably does bring the temperature down, at least in that area of the house, a couple degrees. But the receptors in the house that drive the thermostat eventually register that something is bringing the temperature down, and so the thermostat overrides that small AC unit because it's got a bigger, stronger heater, and ultimately wins that battle and brings it back up. Depending on the thermostat, how strong it is, it might take a while, it might take a lot. Everybody's genetics are different to determine that sort of back and forth. But that idea, that concept is very true for us. We lose weight by restricting calories, and then at a certain point, 10, 20, 50, or even 100 pounds of consistent caloric deprivation, our body finally hits that plateau. We are now eating 50 or 60 or 70% of the caloric intake that we used to eat, maintaining our weight now, which is a scary place to be, and now having and dealing with ravenous hunger, a lot more hunger than before, which is why within a couple weeks, months, or maybe even a year or two, you inevitably regain that weight. And there's so much literature that shows the post-caloric consumption always inevitably coming back. And I'm sure many of you watching this video can attest to just that. And so how the heck do we solve this? And by the way, guys, I mean, the stats on sustaining weight loss are pretty staggering, and this is exactly why. Only 20% of people who lose more than 10% of their body weight will actually keep it off for the rest of their life. So that means 80% of people that go on calorie restrictive diets and lose weight will not keep it off and will ultimately regain their weight back. So this is a very powerful mechanism, and it really tells us the story of what's going on with difficulties losing weight. So how do we turn down the temperature? How do we turn down that thermostat? We have to lower those chronically elevated insulin levels. So the science of obesity, understanding obesity, we have to understand hormones. Our body is a very intricate system that is governed by many things, the nervous system, but hormones are released. They're chemical messengers that cause all sorts of different changes in our physiology. It's actually kind of simplistic to think that our body is so basic that all we got to do is just adjust the caloric intake and then all of a sudden we're going to be able to control weight gain or weight loss. Your body uses energy for so many things. Accumulation of fat is only one thing that your body can do with the caloric intake. It could increase temperature. It could use calories to build tissues, to build mass. Cognition and brain function can be a lot higher or a lot lower. Each organ has a supply of calories and energy going to it, and each of those are going to be governed by hormones, which are going to be governed by the overall operating system of your body. And so the law of thermodynamics, which is something that is talked about a lot when you look at this calorie in versus calories out viewpoint, operates on the idea that that system is static, but it's not, because each of those different aspects of the diversion of caloric intake can be and is altered by hormones. There's many, many hormones that we couldn't possibly talk about all of them, but insulin is the culprit. The function of insulin is storage of nutrients into the cell. It is the most potent storing hormone, period, end. The main function is take the sugar, because you eat, sugar increases. The main function is take that sugar from your blood and deposit it into your cells. But at the same time, when insulin is elevated, it is also attaching to the fat cells in your body and blocking any breakdown of fat. You literally, despite any other variable, when you have insulin elevated, you cannot break down body fat. And we're going to talk about many examples that we can observe from science and other drug usage and other observations confirming just this. So we see that insulin levels are higher in obese individuals, and it's a pretty good correlation. The more obese and overweight you get, the higher we tend to see your insulin levels correlating, and that makes sense based off of what we just talked about. It prevents fat loss. It is a storage hormone. Looking at a couple of examples to prove this point, we think about a type 1 diabetic and a type 2. A type 1 diabetic doesn't make insulin, and a type 2 diabetic stops responding to insulin, right? So they're still making it. In fact, they actually make a lot of it. So very, very different. One has a low to none, and one has very, very high levels. So when type 1 diabetes first started, before you trace back history, insulin was ever an option as a medicine, people would die from type 1 diabetes at a very young age, completely emaciated. Because despite how many calories you eat, if you're not producing insulin, you cannot gain weight. Now for type 2 diabetics, a condition where your body stops responding to insulin, and we're going to talk about insulin resistance in a minute, but your insulin levels increase. And so by increased insulin level, just ask any doctor who treats diabetes and he'll tell you, while the patient was probably already in some sort of couple pounds per year weight gain, that annual weight gain increased dramatically the moment that they started having to inject insulin, which is the inevitable result down a diabetes pathway. We'll talk about that in a whole nother webinar at a later date, because obesity and diabetes are very strongly connected. They both come from insulin resistance, in my opinion. So we can look at diabetics, we can see the differences between type 1 and type 2, telling us this insulin theory of obesity. Then let's look at cortisol, because a lot of people talk about cortisol, and we know it does something with body fat. Well, what is cortisol? Cortisol is a stress hormone. You think of, I see a tiger, I need to be able to sprint for my life. And so cortisol is released, which now causes mobilization of tissues to provide an energy source. So it's gonna spike up your glucose level. And so back in the day, this was a very important thing to happen, but nowadays is not. And we're noticing that this stressor, this trigger to increase cortisol, is happening just on a daily basis for some people due to the stressors of life. And unfortunately, that's getting worse. So is it the cortisol that's causing obesity? Well, what does cortisol do? It increases blood sugar. What does increased blood sugar do? It increases insulin. So you see how cortisol is just a downstream effect leading back to insulin. And we can look at conditions like Addison's disease and Cushing's syndrome. So Addison's is low cortisol. And patients with Addison's disease, one of the side effects is weight loss. They have a hard time gaining weight. People with Cushing's syndrome, they have the opposite effect. High cortisol, high blood sugar, high insulin, they have a hard time losing weight. Then we can look at all sorts of different medications. Do it for yourself, Google some medications and you'll have a fun time doing this, but there are so many medications, and the ones that increase insulin or increase insulin sensitivity, which would make the insulin work better, all have this observable side effect of weight gain that we can observe. Now, just as a caveat, if you've been studying these GLP-1 medications, this would be the only exception. Fascinating aspect to this, in essence, the Semaglutide, Tirzepatide, Mounjaro, Wegovi, they are increasing insulin sensitivity, but because they so powerfully decrease hunger, that counteracts the increased sensitivity. But all these other medications that are increasing insulin sensitivity or increasing insulin itself cause weight gain. And so it's not just diabetic medications, because look at metformin, for example. That's a diabetes medication that doesn't increase insulin or insulin sensitivity. And what is its side effect? It actually is correlated with weight loss, not weight gain, which is why metformin, if you have to be on a diabetic medication, is one of my favorites because it doesn't have weight gain as a side effect. So insulin resistance, we understand insulin and how it affects weight loss. Well, what's causing it to be elevated? Well, initially it's lifestyle, carbohydrates, eating frequently. Anything that's elevating blood sugar, we talked about cortisol too as well, is the initial reason why insulin's elevated. But why does it stay elevated even when I'm no longer eating? It's due to insulin resistance. So essentially, insulin resistance is a condition where the cells in your body, the receptor sites for insulin, because insulin's job is to attach to the cells and kind of open up the gate so that glucose and nutrients can flood in. But those receptors begin to develop resistance to insulin, and the only thing the body can do is increase the output of insulin to get the job done, because if it doesn't get the job done, you'll die much sooner. But if the resistance is a result of high insulin and the insulin resistance causes you to increase insulin, I think you know where I'm going with this. It's like a hole that keeps getting deeper, like a hamster wheel that keeps rolling down a never-ending hill. This is why the progression of diabetes is always thought of as an irreversible disease, and we'll talk about that in the future. But insulin resistance has to be addressed, and we can see examples of insulin resistance in modern medicine. So it develops because your body prefers balance. If you walk outside and it's cold, your body increases the temperature. If you walk outside and it's hot, your body decreases its temperature, right? It's always trying to maintain homeostasis. It's always trying to maintain a balance. Other examples of resistance that develops is antibiotics. You've heard of antibiotics and us becoming resistant to antibiotics, really the bacteria becoming resistant to the effects of antibiotics and them not working as well. Same thing we can observe with virus. If we look at the function of a vaccine, it is resistance. And drugs. What happens to a cocaine user ends up having to take more, and cocaine is an example of very fast resistance. Literally within one time of using cocaine, you'll have to use more and you'll still never get that same effect of cocaine after the first use. So we can see many, many examples of this sort of resistance happening, and it needs to be understood because we have to address the insulin resistance if we're ever gonna get those insulin levels down. Okay, metabolic flexibility. What is it? Metabolic flexibility, in essence, is alternating fuel sources effectively. So we have carbohydrates as a source of fuel, and we have fat as a source of fuel. Fat will then be broken down into ketone bodies, and then the carbohydrates gets broken down into glucose, although you can break everything ultimately back down to glucose too as well via different pathways. At least carbohydrates and protein can. But ultimately, your body needs to have some flexibility, and it needs to be able to alternate fuel sources. But unfortunately, we live in a society right now where we're constantly eating carbohydrates, and we're never putting a challenge to our metabolism to ever have to tap into body fat. Because in order to make it tap into fat, you would have to actually run out of carbohydrates. Your body stores carbohydrates as a form of glycogen for about 18 hours to 24 hours. You could run off of stored carbohydrates, and at about that 24 mark, you're completely burned out of carbs, and you would force your body to run off body fat. Another way to challenge this system and improve metabolic flexibility would be a keto diet, because a keto diet is completely devoid of carbohydrates. And so ultimately your body will burn through its stored carbohydrates, and now it's running off of fat, and it has to do that via ketone body production. But anybody who started a keto diet or anybody who started a fast may have noticed that they felt like crap. You feel like crap because your body is unable to meet the energy demands of what you're asking it to do. Keto diet, you're asking it to change fuel sources because you're eating fat, but you don't have carbohydrates. So we gotta be able to convert that to usable energy. Fasting, you're not eating anything. So you're asking it to get the body fat stores as opposed to the consumed fat and do the same thing. Turn it into ketone bodies for an alternative fuel source. And so this requires flexibility. And unfortunately, we all start off from a very inflexible metabolism by definition of our society and the high carbohydrates and the refined carbohydrates and the high amount of inflammation and all sorts of different reasons. And so metabolic flexibility is correlated with better health. Better metabolic health means overall better health, lower levels of inflammation. And this is why, remember I mentioned earlier about Atkins and keto, people noticed it was much easier to lose weight. It was like I didn't have to count calories anymore. And that's just an observation for some people. You can overeat in body fat. Obviously calories do matter, but they don't matter as much. And partially because the more flexible you are, the better your body is at utilizing fuel, your hunger is controlled. There's a lot of factors that go into that observation that people had an easier time losing weight, but it is due to the metabolic flexibility, at least one aspect of it. Okay, so inflammation. So inflammation is the base, it's the starting point of essentially almost every disease that develops in the body. We hear about it all the time. As confusing as it may be, holistic doctors will put you on all sorts of different supplements. I'm one of them to help reduce inflammation. There is some tests that show inflammation in the bloodstream, like C-reactive protein, for example, ESR, but even if those are normal, you can still have inflammation. So what we know is inflammation is a result of our lifestyle choices, and inflammation will hinder our fat loss. Inflammation will literally make it harder for your body to mobilize the body fat, and it will literally make your body into a more pro-fat storage, kind of like insulin too as well. So we gotta consider both inflammation and insulin, and excess inflammation will make it harder to decrease that fat, at least initially. And so we have to consider inflammation. This is why patients who have, for example, autoimmune diseases will struggle with weight loss more so than a non-autoimmune patient, because their inflammation levels are significantly higher. So we gotta be able to address inflammation if we wanna have successful weight loss. And then finally, thyroid. I can't possibly talk about successful weight loss without talking about thyroid. Our thyroid gland is a very important gland in the body. Every single cell in our body has receptor sites for not just insulin, but also thyroid. Thyroid is the metabolism. The higher the thyroid is, the more calories that we burn. The lower the thyroid output, the lower the calories we burn. But every single process in the body is driven metabolically by thyroid output. And so it's very, very important for overall health to have optimal levels of thyroid, and low levels of thyroid are obviously going to hinder and make it more difficult, not necessarily override unless it's very low, but slow down the ability for your body to burn body fat. Common symptoms of low thyroid. We got lower energy, brain fog, the obvious difficulty losing weight, brittle skin and nails, hair loss, constipation, achy body, intolerance to cold. So if you're suffering with those symptoms, then you have an underactive thyroid. And you got to understand that it's not managed very well in standard healthcare. They look at one blood marker called TSH, and with the TSH, it is a precursor. It's the hormone that your body releases to tell the thyroid gland. And so there's a pretty strong correlation between that and your thyroid status. But a lot of people, millions of people probably, still fall into this situation where their TSH looks fine, but they're suffering with low thyroid symptoms. So in my opinion, it's the symptoms that tell the story way more than the blood work. But this is also why we include a functional thyroid panel, because if you're suffering with those symptoms, that means if we get the thyroid optimized, you are going to experience better weight loss to some unknown percentage, because I don't think a thyroid gland, even when it's optimal, I know will not override a high amount of insulin. We talked about that earlier. Insulin is the master hormone that is going to affect your body's ability overall to gain or lose body fat. And when we talked about earlier how the body has that weight set point, thyroid is one of the two things, along with hunger, that can be situationally modified by the body, up or down. It doesn't just go both from the weight loss standpoint, but it also goes from the weight gain. If you ever notice, if you're gaining weight, if you look at maybe yourself or a friend or family, and you count the calories of how much they're eating, and they're only gaining a pound or two a year, but you look at the numbers and you're like, wait a minute, there's 2,500 calories in a pound of body fat. How the heck are they only gaining like they should be gaining 10 or 15? Because the body is trying to do the same thing. It is trying to return that set point, and by increasing thyroid, it does that, and it's doing everything it possibly can. So thyroid can be manipulated, and your weight loss plateau and your issues and struggles with trying to change your weight can be a reason why thyroid output is low. Or you could have other issues, which I have a whole other set of webinars talking about hormone therapy and why thyroid output would be lower. But for the sake of understanding weight loss, we look at the blood panel and we see what our thyroid status is. And if we need to optimize it, we optimize it. All right, so that is the end of part 2 of our series of the FLOA protocol. Hopefully you've been following along between part 1 and part 2, and we'll see you guys at part 3.